could you tell me, I guess just to start, a little bit about your role as the Executive Director of AMI-Quebec?
Well, as ED of AMI-Quebec, I have to oversee the entire operation, culture, philosophy, human relations, the entire entity, which is AMI-Quebec.
It must be a pretty big job.
It's a small organization, but it's a big job.
Yeah, especially during the pandemic. I'm sure your role has kind of, I guess, increased in the work that you have to do. I guess I wanted to ask, how have you noticed the cases of mental illness, if they have increased during the pandemic?
Yeah, I can't really say that mental illness per se increased, but I think that there are certainly manifestation of increased anxiety, increased depressive symptoms, frustration, anger, you name it. So it's not necessarily mental illness per se, but it is certainly mental health challenges.
Thank you. And would you say that there's, I guess, an increase in pardon me, kind of a shortage in accessibility to mental health services to help deal with, maybe more people experiencing anxiety related to the pandemic?
Yeah. Well, I think that traditionally there has been a shortage of resources for mental health issues, let alone during the pandemic, where we see an increased number of people who require this support. So the answer is yes. I think that, it's also a good question, what could be resources or what could be support services that could mitigate some of the challenges of the pandemic. And this is not entirely obvious because, to increase on a very short notice, for example, counseling services or different programs that have not been available before, it's not easy. It's something that does take time, to build this system. At the same time, there are all kinds of services, such as some of the services that we offer, support groups, for example, that people can join at will. In our case, people can come to support groups. They don't have even to notify us. On our website, there are lots of details about the kind of support groups that are being offered and the days and so on. We encourage people to join by video, but if people have no access to computer or iPhone or video conferencing, they can also join by telephone. So this is just an example of something that has been in existence before. We do see, just to give you an example, yesterday we had 3 support groups. We had 18 people in the hoarding group. These are for people who suffer from hoarding situation. We had 14 or 16 people in the anxiety group, all of whom are people who suffer from anxiety. I can't really tell you who are or how many have suffered before the pandemic or since the pandemic, but these really accommodated people who do have anxiety. And there were 14 people, I think, which are only caregivers in the BPD, in the borderline personality disorder support group. So there is a big uptake of support groups because I think that this may be the easiest. It may not provide an answer for everybody, but it's an opportunity to share experiences with people who go through similar experiences, and this can be very reassuring and also empowering experience. So this, I'm just giving an example as something that we see a spike to some extent. And I think that this is really something, but again, if we had to start from scratch support groups, it wouldn't necessarily be available overnight, even though I have to say that, when we switched exactly a year ago, exactly like, next on Friday, it will be exactly a year since we had a staff meeting where we decided that we are going to switch support groups to a telephone. We started with telephone. So, the 16th of March, which was a Monday, was the first day that we transitioned all our support groups to virtual platforms. So we did it overnight, but we did have support groups from before. So it was really just to change the platform. But if you have to think of new programs, it's a bit more involved.
And you made the switch as a result of the pandemic?
Entirely.
Okay.
Entirely. On Friday we were sitting as staff. I remember one of my colleagues saying, "I think that we have to move to working from home." And I remember on that Friday I say, "I don't think so, not yet." But he did call me over the weekend and he said, "I'm really nervous." I said, "Let's have a staff meeting on Monday and we'll decide." We had a staff meeting on Monday. On Tuesday, half of the staff moved already home and the rest moved, before the end of the week. So we really transitioned practically overnight.
Wow. Okay. Very impressive. And how long before the pandemic were you guys hosting these support groups?
Oh, for years and years and years. I mean, we started, AMI-Quebec started 43 years ago. So we always had, in the first few years, we had a monthly support group, and this was before my time. And then there were three facilitators that would accommodate whoever came. If there were 5 people, the 3 of them would sit together. If there were 50, they were just divided up and into, breakout rooms. But for years, we have been having 10 to 12 support groups every month. So we have support group, every time. It's usually on Monday night. So we have usually 3 Monday every month. So on the 3 Mondays, there is always one support group, which is for caregivers. Caregivers, it's like families or friends, but it's not for the people who are themselves suffering from mental health challenges, but it's really for the circle of support. And all the others are diagnosis based. So we have one on borderline personality disorder, on anxiety, on bipolar, on depression, on hoarding, and so on. So we have been, we have been having these groups for years.
Okay. And are these services, are they free?
They're free. All our services are free.
Okay,
Yeah.
that's amazing. And I guess in terms of the pandemic, what kind of wait list or how long would the wait list be to join one of these groups?
Well, support groups, there is no wait list, because people don't even have to advise us that are coming to the group. And this is why I'm saying, sometimes you would have fewer people, sometimes you will have more. But so far, we didn't really limit the size. When you have 18 people in a support group, it's a lot. But we have been contemplating where should we, what should be the cutoff number. But so far we didn't really limit it. We just really try to go with the flow. If we're going to see an increase, which really makes it untenable, we may have to limit it. But so far, we live with large groups, but at least we hope that it gives something, to the participants instead of turning them away.
Okay. And how would you say that these groups operate, I guess, in comparison to traditional kind of one-on-one therapy counseling?
I have to say that they are working remarkably well. We have not only support groups, but also lots of workshops, which are all online. We do our counseling, family or individual counseling, all online. So there's no question that there is really no replacement for face-to-face. But given the circumstances, it has been really working very well. I think that the first couple of months we saw a dip in that tendency in support group, but few months later it really came back to the pre-pandemic rate. I think that people really had to adjust. But it has been working very well. I have to, to say that we didn't suspend any program. We didn't cancel any program. You know, there was, we basically stuck to our plan, to our timeline. Um, it was really, when I look at it, you know, you said, yes, it was challenging, but it was also very gratifying because we managed to continue to offer our services uninterrupted, practically.
Great. I'm glad to hear that. Um, so I guess I've been thinking about the kind of different ways that people are affected by the pandemic, and I was wondering if maybe you would be able to talk a little bit about ways that people are having their mental health affected by the pandemic that is not just isolation. So maybe kind of financial burden, job loss, childcare, those sorts of things that maybe you've seen.
Yeah. Well, you know, again, I think that it's all of the above. And I think that, you know, it's in one way, this is really what binds everybody together. But in also, you know, another way, we are not all the same. And I think that, you know, the challenges that one person experiences is not necessarily the challenges that someone else is experiencing. And, you know, I have to say that again, my team is not really challenged by having young children, you know, having to juggle education and entertainment for children with work. So we have been lucky in that sense. But you know, I think that people who have who have to work from home and also have to attend to children, this is really a challenge that people who don't have to do that really don't. I don't think that we can quite appreciate how challenging it must be. You know, we get our paycheck coming in regularly. You know, people whose work has been either cut, you know, down or suspended or canceled altogether, uh, face much bigger challenges. You know, when you can't put food on the table, it's a very different challenge than to even, you know, juggle work and children, or you know, and all this is very much associated with your mental health, with your well-being, you know, with your physical and with your mental well-being. So, and you know, to top it off with the uncertainty that, you know, we don't, at this point we are marking the year anniversary. I remember that, you know, the first months when we just moved home, and you know, China was close to unlock their, you know, their lockdown after 3 months. I was thinking to myself, 3 months, we'll have to be home for 3 months. You know, it was kind of, you know, very difficult even to fathom, right? And here we are, it's a year later, and we, for example, are not in any hurry to go back to the office. I think that we are going to continue to work at least until the fall, and I don't exclude the possibility that it would be until the end of 2021. And you know, once we do get back to the office, I think that, you know, uh, we would probably change to some extent. And I think that I can see that we may like to offer some sort of a hybrid model. So, you know, there are really lots of factors that play into the anxiety, the uncertainty, the isolation. Um, yeah, you know, I think that there is a pandemic fatigue, because I think that there is, you know, when you go to a group, for example, when you go for a group that is working 90 minutes, you know how to budget your energy and your time. You know, when you, there is a beginning, a middle, and an end. You know the framework. With this pandemic, there is no certainty about when it's going to be over. And I think that this is, you know, when people know how to budget their energy, it's easier. But when there is really no clue, you know, you really have to adjust your resilience, you know, from time to time. And it's not obvious, it's not easy, you know, and especially ourselves. I think that, you know, we have been, I think that we lived with the notion that we have control over things. And I think that comes the pandemic and basically suggests that we have very limited control over our lives. You know, we have control over how we are perceiving it and what we are doing with it. But this is very different than having control over what's happening around us. We have very little control. So it's, it's new news for many of us. And I think that this is difficult to, it's difficult to adjust.
Absolutely. I definitely relate to that, as I know many people can.
Yeah.
I know we spoke a little bit about this on the phone, but people who can't afford therapy, maybe people who kind of need that one-on-one, what are barriers, do you think that people who don't have the financial means to afford therapy, what barriers do you think that they face?
Well, again, finances is a barrier. There's no question about it. But I think that there are some services. Again, AMI-Quebec is just one example. I'm sure that there are others. And in fact, on our website, there is a pretty comprehensive list of different resources for different things, for food resources, for job resources, for support, for therapy, and so on and so forth. I think that people have to be resourceful in order to find the resources that they can access. And not everything is, costly, but you have to do a little homework. And, I think that it's a given that there will never be enough resources for everybody. But, those of us who have the capacity to search and to do the homework and to put the effort, I think could find some resources.
Maybe this is a little bit more of a difficult question, but for people who they really don't have that motivation to kind of look for professional help, and they just find it kind of too overwhelming, what would you maybe say to them?
Well, I would ask them if they have a friend or if they have a family member that they can, that they can share with. Sometimes it's very difficult, especially if we are really subjected to anxiety and depression and so on and so forth. It's difficult to lift ourselves out of this depression and take care of ourselves. I understand that. I do want to hope that people have someone that they feel, that they can trust. It can be, again, a family member, it can be a friend, it can be a colleague, someone that they can share their situation, and hopefully this someone could assist and could support in, trying to locate some support services.
Okay, thank you so much for sharing this. So I want to talk a little bit about, I guess, Quebec and, its mental health system. So I just have some stats written down. So in the fall, Quebec, they announced $100 million investment in mental health programs. This money is being kind of split up to, mental health services, improving the existing services, as well as greater support to vulnerable areas and community mental health organizations. In your view, do you think that maybe there needs to be more funding allocated, or maybe specific resources to certain components of mental health services?
Yeah, look, I think that prevention, for example, has never been a priority. So I think that, and I don't think that it's unique to Quebec or to Canada. I think that, there is very often focus on putting up fires and not on prevention. And I think that it is either short-sighted or because of prioritizing other areas, or having different outlook, or both. And I think that very often it's both. I mean, we live in a world of finite resources. It's a given. Politicians and professionals have to prioritize needs. The question is really what takes priority, what takes precedence. And my sense is that mental health has never been a priority, unfortunately. And I think that this is something that we have been saying for a very long time, that it's really important to put mental health at par with physical health. And if for nothing, for no other reasons, just because there is really no physical, there's no health without mental health. You know, when we are talking about wellness, we are talking about welfare of people. It is both physical and mental. And I think that it's unfortunate not to recognize it and not to, you know, not to refer to mental health, at least as the system is taking physical health. So I think that this is, you know, this is a big shortage. And again, if the pandemic is teaching us something, I hope it does teach us that mental health is really something that we cannot dismiss, that is really something not only that is going to stay with us for a very long time, it's going to stay with us forever. But, you know, I think that we may see the fallout of this pandemic for many years to come. You know, children and youth who have been deprived of their normal, you know, developmental stage that takes into a big consideration social interaction. It's going to be tough. If we learn something from it, and mental health is going to be considered more as a priority, maybe it wouldn't be entirely in vain.
So for us to maybe imagine mental health being put is on the same kind of level of importance as physical health, what would you envision? How could we see this looking like?
Okay, just to give you an example, you know, today when someone is diagnosed with mental illness, the main treatment option that is, it's not even an option, the main treatment that is offered is pharmaceutical treatment. I think that this is the, you know, the centerpiece of psychiatric care. This is not the only thing that is possible. I think that many people don't even realize that it's possible to have, you know, there are other treatment modes. For example, I just read a couple of weeks ago an article in, you know, by BBC. In Norway, they are having now a medication-free treatment program. So people who don't want to be treated with medications can opt for a medication-free treatment. But you see, in order to offer it, in order to, you know, to make it possible, first of all, you have to recognize that medication is not, you know, is not a gospel. In fact, I think that it's much less than that. I think that this is, again, this is altogether a different topic, but I think that, you know, the reason why we are such a medication-based treatment society is because of the strengths of the pharmaceutical industry, and, you know, and also because I think that there was a desire on the part of other stakeholders in society to understand mental illness as a brain disease, as an illness, which is not clear that this is really the case. It's probably, you know, again, there is a genetic predisposition, there is a biological component, but it's much more complex. It's multifactorial. It's not just simply a brain disease. So I think that, you know, if you recognize that and you say, well, you know, there are other possible treatment modes, but you have, first of all, to recognize it, then you have to make it available. And I think that there is a notion, and maybe rightly so in the short term, that medications is quicker and cheaper. In the long term, I don't believe that this is necessarily the case. But, you know, if you really do believe in medication-free treatment, you have to allow for therapy for people who want it. Sometimes for therapy for the entire family. I think that in the long run, it pays. And in fact, like, you know, there is a program that was started probably about 30 years ago in Lapland called Open Dialogue, which is very much, you know, a medication-free treatment. And there are pockets in different places in the world. But, you know, you have to want to do that. You have to be, to offer it. You have to have patience. And you have to also factor into the decision what the person wants. not only what, what the psychiatrist is, suggesting.
Could you maybe even see something as well, kind of like how we, go to the doctor every year, every 2 years, just for a checkup? Would you like to see maybe something like this, but in terms of mental health?
Absolutely, but I think that it should be, aligned together with physical health. I think that, if we have a GP today, which is really, he's not a specialist. He is a doctor that really oversees your entire well-being. I think that this is the role of the GP to ask, so how are you doing socially, mentally? Because when we are talking about mental health, we are talking about social, functional, family, the whole gamut. And I think that this, my sense is, I don't think that you have to go to a psychiatrist to do mental health inventory. I think that it's the GP who has to be trained, to oversee the whole person, because this is what we're talking about a whole person approach, right?
Thank you. I just wanted to ask, I've definitely noticed kind of, with people I've had conversations with, one of the barriers in accessing health, again, is financials. Do you think maybe, especially in terms of kind of bringing more importance to mental health, as well as kind of reducing that barrier in people from accessing it, would you like to see all mental health services be, public and funded by the government?
Well, it's an overarching concept. But what is all mental health? Not all physical health is funded by the public sector. But I think that even less so when we talk about mental health. So yeah, I would love to see more mental health resources available. I think that we are talking about mostly about counseling and therapy, because this is really very far and it's very difficult to access. If one is going now, CLSCs are the porte d'entrée, and if you're deemed requiring therapy, you can wait probably for a year and maybe even more than that. And then it's very limited for 8 or for 10 or for 12 sessions. This is not necessarily, this I find sometimes, the attempt to improve mental health services a bit of a lip service. I think that you really have to, if you're really looking at mental health and you recognize that mental illness, for example, is not really, it's not just a brain disease per se, but it is very often, or mental health challenges are very often associated with trauma or with, early experiences. You want to visit this trauma, you want to visit these experiences in order to be able to move forward. When you take Prozac, it doesn't help it. When you take Prozac, it may reduce the symptoms, but it's not going to deal with the cause reasons for the challenges. And if this is really what you are trying to do, and I think that this is what our system is doing mostly, this is, these would be the outcomes. But if you really care about the people who do have mental health challenges and you want to help them, I think that you want to give them the opportunity to look deeper and not just, to encourage them to take, medications.
Very, very well put. Thank you. I'm gonna finish it up because I know you've given me so much time already. I just have two last questions. Kind of on a similar level to my last question, I was reading about wealth tax. So it's essentially like taxing people with higher incomes and then putting it back into services such as mental health. And this is something they've done in California, I think a couple of years ago. And there's been kind of a good outcome from it. Do you have any thoughts on this? Do you think that maybe this would be helpful in providing more access to mental health?
I'm not quite sure that I follow you. It's like people with higher income who put their, so it's practically making donations towards services.
Exactly. So they have to pay more taxes, and they taxes specifically are put towards, you know, different things in terms of wellness, but one of them being mental health care.
Right, right. You know, first of all, you know, I think that yes, absolutely. People with higher income should pay more taxes. There is no question in my mind, but it really depends where you are coming from. You know, I'm coming from a more, you know, socialist kind of based philosophy. So yes, I believe that this is absolutely important. I think that, you know, but when you live in a pure capitalist society, it's much more difficult to convince that, you know, people who do have to share with people who don't have.
Thank you. And I know this is kind of a big topic. I'll end on it, but I was reading, so I mean, I know this has probably come up for you a few times, but within the past year, you know, we've had a lot of conversations about, you know, police responding to mental health emergencies and them being replaced in this. So Valerie Plante was asking for more funding from Quebec in order for social workers to work alongside police in responding to these cases. Do you think this is helpful, or maybe would you like to see just someone completely take over a police presence when responding to these calls?
No, I think that police has a place. There is no question about it. And by the way, you know, the police force, at least in Montreal, has been attempting to provide some mental health training to police officers. And I know that, you know, at certain point, in each shift, in each station, there was someone who has gone through some training. I don't think that it's enough, but I think that the intention is there, and I think that it's a good intention. I think that police need to have some understanding of mental health, but you cannot assume that they are social workers or psychiatrists. I think that, you know, you may know that, you know, in Montreal, there is a project called UPS Justice. And this is a work of the police together with community workers whose role is exactly that, to escalate conflict and to basically to bring in the mental health expertise. So I think that, yes, I believe that this is exactly what needs to be done. I think that, you know, there should be a better collaboration between the police and mental health practitioners. So, you know, when need be, you know, they will go together to address a conflict. Absolutely. But I wouldn't really, you know, I wouldn't fire policemen at all. I would just, you know, enhance their understanding of mental health. And I would, you know, create teams that would be able to support in each other when mental health is concerned.
Thank you so much. The group, it's called UPS?
UPS Justice.
Justice.
And this is they are working from CLSC Le Faubourg in Montreal downtown. So they are limited. I believe that their territory is limited to downtown. I don't know what is the postal code, but it's not available anywhere or everywhere in Montreal. But, you know, if there is, for example, a 911 call for a conflict which is mental health related, it would be UPS Justice who will go to the place. And if need be, this you want to check. I think that they would be the first one to be called, or maybe both then and the police will be called. But, you know, they will be a very active actor in the, you know, in the attempt to escalate this, to de-escalate the conflict.
Hey, thank you so much for letting me know this. I'm definitely going to look into this more. Is there anything that I didn't ask that you think is important for me to know or consider when putting this story together?
You know, there are many things, right? I think that, you know, my work, the work of AMI-Quebec is mainly with families. So, you know, even though we work with, I mean, support groups, as I mentioned earlier, are open for people with different kinds of challenges. So, you know, people with different mental health problems are invited to some of our programs. But when we design programs, we design it with the needs of families. And when I say families, it's not necessarily the biological, it's the circle of friends. And I can't really stress stronger the importance of families. You know, I say very often that mental illness is a family affair. You know, it's like Hillary Clinton used to say, it takes a village. You know, when there is mental illness in the family, everybody is affected. It's not just the person who is diagnosed. Everybody around is affected. So I think that, you know, if there is a message from my perspective is, it is that it's really important to pay attention to the needs of families and of the circle of friends if we want to help people with mental health challenges and illnesses.